Any election is a period when, to paraphrase Kim Campbell, it's a tough time to have policy debates, and I know that Prime Minister Campbell got grief for that statement, but unfortunately there's a ring of truth in it. So I do hope that we can avoid getting into ideological posturing or waving the Constitution aloft and saying, you know, healthcare is not a federal responsibility, etc. I would hope that healthcare will be an issue in this election. The reason is simple to me. The federal government has created our system. We had provincial experiments with universal coverage of hospitalization. It was a conservative government in 1957 that gave us universal hospital insurance. And it did so by cost sharing with all the provinces, 50-50. And then for medical services insurance, some provinces were beginning to tiptoe towards universality, but Saskatchewan took that step. And we had a conservative government appoint Mr. Justice Emmett Hall and his panel who recommended universal Medicare. And it was a Liberal government that passed that. But in both cases, it was Canada's federal government. And in 1984, of course, we had the consolidation of legislation under the Canada Health Act. And that was done by a Liberal government, but Mr. Justice Emmett Hall had a hand in planning that, and he was appointed by a Conservative government. So I guess my point is both Conservative and Liberal governments here in Ottawa have taken a very strong hand in shaping the system we have. And whatever the Constitution says, I think there is a need for all three parties to think about where they stand on healthcare and what they're willing to do to try to make this system better. And I think Canadians agree with me. There's a poll out very recently that shows 73% of Canadians think that healthcare is or should be a serious issue in this election. That's almost as high as those who are focused on the economy and job creation. And it tells you healthcare is still very much on the federal agenda, whether any of the three parties like it or not, and that's where I think it should be.